Hi, I'm Maisie and welcome to Public Health Spotlights. Today I'm joined by Darrell Gale, Director of Public Health at East Sussex County Council. So welcome, Darrell.
Thank you very much.
Darrell, in your own words, can you just tell me what is public health and why is it so important?
Okay, quite a few people have said, given definitions, and I think one that I liked was the political wing of medicine, but I'm not a medic, so I can't really use that. I think from my perspective, it's quite simply about getting the best for your people in your place. And that's through a whole raft of things. That's through service provision, that's through the environment, that's through housing, that's through services that are about detecting disease, treating disease, etc., influencing on the NHS and other services. So it's really, really big, but it's really quite a simple concept of just doing the best for the people that you're serving.
And how did you sort of get into being how did you get into public health and being a director of public health?
It was a very long route, really, because I originally trained as an architect, and on completing that and wanting to get the professional practice, the building industry was in meltdown at that time. So I fell back on some voluntary work I was doing around HIV prevention, and I enjoyed that so much. I got a job in that and developed from that, and kind of very gradually just professionalized what was more of an activist and community sort of based work, firstly as a volunteer and then in paid work. And then, as I say, you're professionalising that, getting certificates in health promotion, widening the scope from narrow sexual health and HIV prevention into sort of wider public health areas, having a geographic focus when I changed jobs. And then it was kind of, well, where next? And it was obviously to pursue a master's in public health and to then see where that took me.
Sure. And what made you go from being a consultant in public health to becoming a director in public health?
I think because I've always sort of wanted to sort of have leadership in my job. I like looking at something, big picture stuff, looking on it and directing others. I really enjoy managing teams and developing people. And so the very best way is to actually, I think, become a director in that case. And certainly here, I've got a very large team. And it's really important for me to know every single one of the team and to know what they're wanting to do with their careers, where they're wanting to go, so that I can help them. And I think for me, it's always the leadership role and the team role is always about actually helping people where you've got talent, helping them sort of leapfrog you and get on, and they can do bigger and better things than you can. And so that's one part of the job that I really love.
Yeah, would you say that's the most enjoyable thing about being a director of public health, or is there anything else specific that?
I think having a real sense of the place that you're and the population that you're serving. I know East Sussex really, really well, and I did before I got the job here. But it's still sort of getting out there, finding out from people what their needs are, talking to people about sort of some of the issues that are affecting public health, some of the data, some of the population stuff. And people often don't see all of the picture. They see part of the picture, the thing that affects them. And when you put it into perspective across the whole county rather than just in their town or their village, people start seeing the value of what we're doing and are very, very supportive. And I think that's a really good thing. When you've got some really hard issues to address and you know that those issues are focused in place or focused in groups of people, not equally spread, you kind of need the support of everyone to get the work done.
And in East Sussex, is there anything sort of specific in terms of some opportunities or challenges that population brings?
I think the biggest challenge is we're in the southeast, and the southeast is all seen as being wealthy and leafy and green, and we're green certainly and leafy, but we're far from wealthy in East Sussex. We have some health outcomes in the county that are of the nature that you get in places like Blackpool, Hartlepool, the northeast, and yet we're 55 miles from central London. And that's all historical. That's all about the geology of the land. It's all about how it was so impossible for people to get from places like Hastings to London except for by boat, So that isolation is kind of wired in to the challenges that the population now face, to the the health inequalities to the life expectancy gap and so on. And so they're the real challenges. And it's very hard to speak about that degree of deprivation when you're in the southeast, when you are surrounded by those areas of wealth, and where you are seen comparative to them, and also seen in London's shadow. London's shadow really doesn't cast at all over East Sussex, and so we are very, very much, I will say, in the southeast, but not of the southeast.
Yeah.
But you asked about the opportunities. I think the people are the opportunities, because the people here are absolutely great. They respond, they react in their communities. When we had COVID, the community response, voluntary sector, parishes, neighbours, just working together and getting stuff done and trusting each other, and not setting up barriers between different groups of people. So our real strength is our people, and our real strength, I think, is their understanding of their communities, their understanding of their needs, their priorities, and their ability to do things and make things happen themselves.
And over the time, sort of being a director of public health, has there been one standout specific challenge that you've overcome?
Well, I think, of course, it's COVID. It's the pandemic. We had the first confirmed cases alongside us in Brighton and Hove. Many of the people involved in that worked in the county, so we were from the day one right on that front line, and having to juggle that kind of, do people need to know that a head teacher's infected? Do people need to know that a GP is isolating? Whilst everything was still very much under lock and key, and then it was a case of sort of, well, how do we get the population to trust us in what needs to happen?
Yeah.
So much was uncertain, so much changed overnight. So we're dealing with, today we're asking you to do this, tomorrow we'll ask you to do something different, and to take the population with us so that they still trusted us was I think, certainly here at East Sussex, it was a phenomenal team effort across the council's leadership, the members and the departments. It was everyone pulling together, and it really was a team effort that on the ground led to at certain times fewer infections than other places, less harm, more continuity of service. We could see some things that we were doing. We were getting better results than the neighbouring places, and at times as well, there were times when, particularly when the new variant came in just at Christmas 2020, when things were really bad here. We had some of the highest rates. That new variant really came in so quickly, and yet again, it was a case of, we've got to tell people just to go back to isolating. It's coming up for Christmas. They've got to act. We had the tier system. We had to kind of make sense of that. It wasn't ideal, because we had half the county in one tier and the other half in another tier, and it was almost like you can't turn people to do U-turns in Pevensey.
I remember that.
You can't do that, but we had to get people to look after themselves and look after others that were more vulnerable, and I think we did a very, very good job, and we did that by sort of not using scare tactics, not overemphasizing, but just hearing. And I think the main thing was dealing with that uncertainty in a very human way, not being overly scientific, not being overly academic in assessing that, but using basic language, basic structures, and also communicating that it is uncertain. It's uncertain for us as well. Do bear with us. We are here to look after you. Yeah. And I think getting that across was really, really a big part of those years.
And is there any sort of particular skill that you wish you developed before becoming a director of public health that could perhaps have, I don't know, better prepared you for those sorts of emergencies or any other emergencies?
I think the public health training I had really did help me. I came out of training in my final year with swine flu epidemic. So where I was training there in West Kent, I really got a sense of how to step up into that space, how to respond, the leadership role of public health, and again the uncertainty and the the real challenges of communicating, a lot of stuff simply, but with authority, and yet still hearing how people react, still seeing how people react, and knowing what you need to do if things, if your message isn't landing well, what do you then do? So I think we was as prepared as anyone could have been, but it was still very much such a rapidly escalating situation. Was it a shock? Well, no, because we trained for a pandemic and we knew it was the top of our list of emergencies. Yet, actually, to have the first case, sort of someone working in your county, living next door, that was a bit of a shock.
And you're obviously a member of the Association of Directors of Public Health. What does being a part of that network mean to you?
It's super important because the association really does. Firstly, it provides you with support. It provides you with peer support. It provides you with a private space to go to take up any concerns, any niggles that you have. Sometimes when you're tossing about with an idea and just thinking, oh, what should I be doing here? How can I do this? What's the best way forward? You've got a set of peers that won't give you an association view. They'll give you a range of views, and they'll also let you speak because it's peers. It's not a hierarchical system. So I think that's really important. I mean, secondly, I think is the advocacy that they do. The fact is that the ADPH has a really strong voice now, a really strong voice nationally in the media throughout COVID and throughout the cost of living crisis and into the climate crisis. It has a really strong, powerful voice with government, with the media, setting the profession's views across and advocating on behalf of local government. And I think that's important. Directors of public health, certainly in England, are based in local government. And so setting aside a really clear angle of this is what local councils are doing and this is how they're doing public health, not just with the director of public health and their team, but with the wider council's agenda. And I think they really get that. And so speak very, very fluently on that.
And then just going, you just mentioned climate change there. Last year we attended the ADPH conference and watched you give a talk on the profound impact of climate change, sort of specifically around flooding, extreme heat, forest fires. What would you say the biggest future priority within climate change for public health, for future directors of public health to be aware of, perhaps?
Well, I think for us in East Sussex, not a week goes by without there being something to think about in terms of the climate crisis. So that might be a weather and flood report that even on a beautiful sort of June day like this might be sort of saying, there's a potential for a storm, there's a potential for flash flooding, there's a potential for that really heavy rain, the type of which 25 years ago you'd see very, very rarely. Well, now in the summer, we get warnings like that virtually every week of storms that may hit, and they may be very, very precise where they hit, but the profound effects could be huge, such as the flooding of a whole town's town centre, the impact on services, electricity, sewage pumping, all those sorts of services. Then there's the coastal erosion again. Almost not a week, month goes past without a lump of the cliffs falling in the sea, or even other land further away from the sea. There've been landslips that affects people's houses, that affects the roads. You get through to autumn and winter, and you've got storms and high winds. And in the last winter, I think there were 4 storms where the Met Office told us this could be as bad as the 1987 storm, which I lived through, and it's just like, really, I don't want to see that ever again. And yet, 4 times this year, and those just occurred a little bit off the coast. They affected northern France, or they affected the Channel, and didn't come inland. So it's that increasing number of disparate effects. So it could be fire, it could be heat. When we had heat wave a couple of years ago, we saw straight away the impact on our elderly population and the peaks of excess deaths that followed those hot temperatures a day or two afterwards. So we're really poised to respond to those things. But it's the unknown, but it's the picking up, it's the pace is getting faster and faster. And I think that's our challenge. And that's before we get onto some of the things we know are coming our way, such as vector-borne disease, mosquito-borne disease and things like that. We have a lot of wetland in the county. We are very close to ports. We have one port in the county. So the way that those mosquitoes could get into the county, it could be very, very rapid. And then that's not likely to become a major disease issue straight away, but it's going to be new, it's going to be shocking, and it's going to be rare. And again, taking the public with us on understanding the transmissibility, the preventative factors, and the things that we have to do to monitor as well. That's going to take some time to bed in. So we can see that happening over the horizon. We can see that coming to us quite quickly, we expect. And so it's just the whole range of things that climate has for us here, on the coast, in the southeast, close to the continent. There's a lot to take on.
In an ideal world, if sort of local authorities had much more funding than they do at present, is there anything sort of at the moment you think local authorities should be doing more of to prevent or to manage health impacts from climate change?
I think one of the things we can do is just work more effectively with partners in our county. That's in districts and boroughs with planning systems and housing and so forth. But it's also including some of our functions such as adult social care, thinking about the management of care homes, the management of temperature and air in those settings, and with the NHS. So I think it's about embedding work together and setting up the systems, the monitoring of information, the monitoring of things that show an effect, both positive and negative, that you can say, actually, we've got something happening here. We've got something happening with excess deaths. We can monitor those things a lot more closely if we had a little bit of extra resource. Not necessarily for ourselves, but to tie in our partners and to make it a shared responsibility and a shared must do. Because I think at the moment, a lot of agencies are doing their own work, but to draw it all together and to have it working as one, we're quite some way from that.
As your sort of director of public health at the moment, have you got any plans, like future career plans, or what could potentially be next for you?
Yeah, I've been asked about this a lot recently. I don't know whether it's because people think, it's time to move on, Darrell. I mean, I've been here 6 years, and 2.5 years of that was COVID. So I actually strangely still feel quite new. And I've still got many of the things I set out to do when I first came here to do, but in a changed environment, in a changed world. And so, I think it for me at the moment, it's very much hopefully about staying put here in this county, and it's certainly about making some inroads into some of the really difficult issues, particularly things like suicide at Beachy Head being one of the kind of biggest outliers that we face as a county. But it's also about sort of getting people ever more focused on those inequalities and our difference within the southeast, and getting people to realise that parts of the southeast are as poor, face as big a health gap as areas in the north. And we have to focus on those. We have to focus on our economy, have to focus on the growth and the jobs that are going to benefit people, the education that's going to support them. And also, I think one of the things is about rejuvenating the county. We're a county that's getting older far faster than the rest of the country. We already have more over 85s than almost anywhere else in the country, and we're about sort of 15 years ahead of the country with that ageing. That's where we are now, and that's going to draw on our services to provide the support. But what we need to do is to bring in and keep hold of our young people so that they develop businesses and skills here, they develop wealth here, but they can also provide that care as well. And so rejuvenating the county and getting over that image of it being a kind of retirement zone to actually be a place where, and it is a great place to live. It certainly is a fantastic quality of life that people can have down here. So there are all those challenges still to face in the county, and I'm absolutely raring to go on them and to coordinate that with the council's other agendas.
So you'll be sticking around for a bit then.
I hope so.
But for our audience, what sort of options are there as a director of public health for progression in career, and where could they go next?
I think many directors of public health like to go to different areas. They like to go, if they've worked in a city, they like to go to a more rural place. If they've worked in a tutor system, they might want to go to a unitary. But then there's also the kind of regional director jobs within OHID. There are health jobs in the NHS, sort of director of population healthcare jobs, and so on. The public health skill set is very, very wide, and it means that you can go into a lot of places. Plus, also, they're staying in local government and looking at chief exec jobs or wider executive director jobs that people can do as well. And some go into the civil service, go into OHID or UTSA into those roles. So I think obviously getting to be a director of public health, getting to be a consultant is a very broad path in. But actually, when you're there, the future is also very broad and takes you down a number of different directions. And I think that's one of the joys of the job, really, is knowing that we've come from so many different places and that no DPH is the same as the next one. And where we can go in the future, where we want to go, can be as different and fit our own interests. And it's not just a kind of narrow funnel where you can only get so far and then you get stuck and then you wait to retire. I think there's a lot of places you can still go.
Well, and then just have you got any sort of final advice or words of wisdom for anyone considering a career in public health?
I think one of the things is to recognise why you want to do it. The most important part of the job, I think, is the passion for public health, the passion for fighting inequalities, for social justice. I think the training scheme is ever more oversubscribed. We get fabulous trainees, registrars coming in every year with amazing CVs that just make you so jealous. But at the same time as all that brilliance, you've got to have that fire in your belly to turn around injustice, to make a difference for people, and to do that so broadly in terms of how you do it, with whom you do it, what issues you focus on, the skills you use, the type of colleagues you work with, and how you develop them. So it's really about, the core thing is about having that passion. And I think, anyone with that passion can then work their route through specialist training, the academic courses, portfolio routes, different levels of job that they can go to. If you want leadership, you don't necessarily have to become a consultant. There are other roles within local government that you can bring all your public health knowledge to, where you work in alongside your public health department in a policy unit or something like that, where if you just don't want to make that, throw your hat in the ring to do specialist training, you don't necessarily need to. But I think the most important thing is the passion.
Well, thank you so much for joining this, Darrell. Really enjoyed our conversation and your insights have been invaluable. And to our audience, thank you so much for your continued support and engagement. And see you on the next episode.
Thank you.
What's